Hello, everyone. Greetings of the day, everybody. I'm Priyanjali from Beautiful Spotless Skin team. I'm sure all of you must be keeping good health. To look beautiful and smart all the times is quest of humans, right from the beginning of civilization. Few of the common conditions affecting the look and feel of a person is acne, hyper or hypopigmentation, and even hair loss. Out of these, acne is a big concern. Acne vulgaris is a chronic condition affecting more than 85% of adolescents and young adults. Yet, despite its prevalence, there are still widespread misconceptions and stigmas surrounding acne. That's why today's live, we are addressing a common yet impactful issue that affects millions worldwide. Acne goes beyond skin deep, often affecting emotional well being and self esteem. Despite its prevalence, there are many myths and stigmas surrounding acne. Join us as we delve into acne management with our skin expert, aiming to debunk misconceptions, foster understanding, and empower you with effective solution for clear, healthy skin. Whether you are battling breakouts or simply curious, this session promises valuable insights and interactions. Today, we are honored to introduce Dr. Ipsita Debata, a renowned skin expert from Bargarh. Dr. Ipsita Debata, M.B.B.S, M.D, Skin and VD, is highly regarded consultant dermatologist, cosmetologist, and trichologist with over 10 years of experience. She is known for her expertise and compassionate approach at Dr. Shakti and Dr. Ipshita's Skin Fertility Institute. Dr. Debata's comprehensive skill set includes a fellowship in laser and aesthetic medicine from New Delhi and a diploma in cosmetic gynecology. Her practice spans a wide spectrum from treating skin conditions like acne, aging related concern to offering advanced cosmetological procedures that enhance natural beauty. As a trichologist, she specializes in diagnosing and treating scalp and hair disorders, ensuring holistic care of the patient's dermatological and aesthetic needs. Today, we are privileged to have her with us, and she will be sharing insight on acne and its management. We extend our heartfelt gratitude to you, Doctor. Thank you for joining us today. Without a further ado, let's move ahead with the first question. The first question would be what is acne and what are the types of acne lesion?
Thank you, Priyanjali, for the wonderful introduction. Uh, Acne is actually a chronic inflammatory disease. It is mostly a disease of pilosebaceous unit, one oil gland. It is called oil gland disease, mostly commonly found about the face and trunk area. Commonly we see over that area. And
Right.
generally, it commonly covered 80 to 85% what you to also spoken in
Mm-hmm.
the introduction, discovered that 80 to 85% of the population.
Right. Right. So, doctor, the main issue with any condition, any disease, is identifying the disease. So, about acne, if we speak particularly about acne here, how does the initial stage look like? How can one know that he or she is having some changes on the skin and this is acne?
Mostly it start around the puberty time. There is a stimulation of the androgen, stimulation of the pilosebaceous gland, the oil glands. Then thereafter there is a enlargement of the oil gland leading to uh, increase in sebum production and oil production. That lead to more keratin production. After that there is a inflammation of the gland leading to what we call the bump. So
Right.
this is the course of the disease actually.
Hmm.
And again
Right.
it will settle down with pigmentation, hyperpigmentation.
Right. So, are we saying that everybody with hyperpigmentation has a chance of having acne or acne?
Mostly, mostly not all patient lead to hyperpigmentation. It is the disease sequelae disease sequence. It may lead to either hyperpigmentation or scarring. You must have seen that few people are more scar prone. The acne lesion
Hmm.
leading to scar, leading with subsidies with scar production.
Right, right. So, speaking of acne again, we now know how does the initial stage look like. So, if a person visits a dermatologist in the initial stage and he or she is able to identify the change on the skin, and the doctor says that this is acne, so can that be cured completely in the initial stage if the patient visits the doctor?
Yes. The disease can be cured in the initial stage. Generally, the
Hmm.
acne has four grades: grade 1, grade 2, grade 3, grade 4. When a patient
Hmm.
came to us with grade 1 acne, we generally prescribe only topical medication. When they ignore
Right.
the disease and do some self medication or any local remedies, and they came to us on grade 4 acne, we have to give them oral medication. So it depends upon the grading of acne or severity of acne, the treatment based on the severity of the acne.
Right. So, doctor, does a specific area in the face acne has different causes? Can there be different causes behind that, or is the same?
Yeah, yeah. The face has more oil glands. Like this, the trunk have oil gland. So more acne we
Hmm.
generally found in the face. Similarly, we found the acne over the back also, and the arms also. We generally over the chest area. Different type of acne are there. One is called drug-induced acne. Generally, we see over the chest area also. We see this type of lesion, acne lesion over the chest area.
Right. And is there also a genetic predisposure? Can there be a genetic history behind it?
Not genetic, but the skin tone mostly we get inherited. Means what type of skin texture we have, we got from our
Hmm.
parents. So
Hmm.
uh, if a person having a dry skin type of skin condition from the parents, so it can be inherited.
Hmm, 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 hmm. So, because it can be inherited, you mentioned, what are the possible steps one can take in order to, restrict themselves from having acne in future?
Restrict themselves for having the acne, right?
Yes, yes,
That
yes.
mostly one thing, if patient can restrict them having a small regulation of the diet, because nowadays
Hmm.
we are more seeing acne related to PCOS. PCOS means polycystic ovarian syndrome. There is a
Right.
gynec condition where the patient is generally obese, having hair fall, and
Hmm.
hirsutism, unwanted hair. Again, here she has acne and more development of seborrhea, means dandruff. All these are having a syndrome-like feature, and that also leading to acne formation. In that condition, we generally ask them to first treatment is decrease the weight. Having the first treatment is the weight reduction. Thereafter, we have to treat it. It is a multidisciplinary approach. Treat the gynecological condition. We have to deal with the gynecological condition also, and also the skin disease. And in diet, we generally ask them to restrict the rich in carbohydrate diet. We advise them to restrict, and some cases we ask them to restrict the dairy product like paneer. All these things
Hmm.
have to restrict them, and in that way, the diet can modify or help us to treat the acne.
Right. So we are saying that the diet has a important role to play in acne as well. I think we did not know about this before. We normally blame the external factors mostly, but we always say that when it's about skin, it's always mostly the internal factors. Doctor, what do you have to say about that?
Actually, in my patient, I ask them, if you want a good skin, then you have to leave your taste buds, because obviously the
Hmm.
carbohydrate food is more richer and it is more soothing for the taste buds. But if you can try also, take one full chocolate one day, then next day you will get three four acne. It is that much.
Ah.
You can examine also.
राइट राइट सो एज वी ऑलवेज से कि आप जैसा खाएंगे आप वैसा दिखेंगे द काइंड ऑफ फूड यू ईट will make you look like that. You avoid sugar, you avoid carbs, your body will definitely evolve in a different way. And the kind of junk food people nowadays are having, the kind of diet people have, the kind of lifestyle people have nowadays, is this actually having some adverse effect in their health?
Yes, definitely. Food has a great relation with the person, those who are taking more antioxidant food, those who are taking more green leafy vegetables, restricting them from rich carbohydrate food. Obviously, they have more
Hmm.
less oxidative stress on the body, and the skin is likely to be glow more.
Right,
and also
right.
shedding light
Moving
in the
ahead.
acne also.
Yes, please, please, doctor. So, yeah, moving ahead with the next question. Doctor, what are the procedures available for acne treatment?
Mostly there are four types of acne, four grading of acne: grade 1, grade 2,
Hmm.
grade 3. Mostly grade 1 we generally give one preparation called retinoids. We generally prefer. In grade 2 acne there is both papule and pustule type of lesion. There also we prefer topical preparation, जो लगाने का देते हैं, we generally prefer, and along with some uh, other medication which generally improve the skin tone. But in higher grade, like nodulocystic, larger lesion are there, inflammatory lesion are there we generally advise oral medication. But all these type of lesion, those people who are came to us for acne, they are actually very much concerned about their skin. And to reduce these all these lesion in a, because medicine will take time to work, we generally add few procedures to decrease that inflammation skin lesion on a certain time span. For that, we generally prefer chemical peelings, uh, and different type of chemical peels are available. We generally
Hmm.
prefer even other procedures, lasers procedures, to settle down that lesion in a certain span. One.
Right, doctor, because we are talking about treatment procedures here. Speaking about skincare now, there are a lot of retinoids, peptides, niacinamides, a lot of products available in the market right now, and people, women, men, they use them extensively. So, can those also somehow lead to acne formation? Also, can over-the-counter medications also lead to acne formation?
Yes, over-the-counter medication most of the time leading to acne formation, because nowadays one term generally used at dermatologists, that is topically steroid damage, TSDF. So many of the over-the-counter products, they contain steroids, and people are
Hmm.
using it for fairness cream for, they, if they have a grade 1, grade 2 acne, they are using all this product. Now after that they will get the grade 3, the grade 4 acne, increasing the scar production, along with the thinning of the skin. More of the history like feature they will get with over years of or months of use of these type of creams. And nowadays this is on peak. This topical steroid damage space is a very bothersome thing for dermatologist also.
Right, right. Also, doctor, for people with sensitive skin, the scenario looks, I think it would seem very different from the rest of the people with normal skin or dry skin, maybe. So, people with sensitive skin, if they are continuously using those products in their skin, can that be very harmful? Also, how does acne look? How is acne maintenance for people with sensitive skin?
Generally, we ask the sensitive skin with acne person to use
Hmm.
all these medication with the advice of a dermatologist only. Because generally,
Right.
acne prone, we advise different type of sunscreen, different type of moisturizer. General moisturizer or sunscreen they can't use, because that will also increase the acne proliferation, because oil, a few of the sunscreen you might have experienced also, they are oily. So generally, type of sunscreen we advise for acne prone skin is different from the normal person, but sensitive skin is different from a normal person. So always
Hmm.
it's advisable for a sensitive skin person or a acne prone skin person to advise, take the advice of a dermatologist before applying any type of cosmetic. And whatever available in the market, all are not going to suit every skin.
Right. Right. Which we never accept, or we never want to know, or we never want to believe. We always believe the celebrities, the influencers which we see online, the products, the company ads. We just trust those. But that's not the right thing to do, you know. It's your skin, it's your face you're putting at risk. Please be a little careful about your skin. Please do not trust anybody regarding your skin except for the expert. That's what we always suggest. Moving ahead, doctor, we have talked about the kind of food which we should avoid during acne. What about the kind of food which we should have for for the acne to be better, or for the people who are suffering from acne? Any food or dietary changes that can be really helpful for them?
More green leafy vegetables, less carbohydrate rich food, protein high protein rich food, and nuts. All these things are going to increase the oxidative process, inflammation, increase zinc is anti-inflammatory, has some anti-inflammatory property. The foods which are rich in zinc, all these things decrease the flare up of the acne and going to improve the skin tone also.
Right, right. What about vitamin C, doctor? Can vitamin D, vitamin C be helpful? Can the sun rays be helpful for them? Do they actually need to go in front of the sun for some time in every day? I mean, which would be the perfect timing to go and sit in front of the sun?
30 minutes in the morning, sun exposure is definitely uh, beneficial for every inflammatory lesion. But as such,
Hmm.
vitamins acne is not that much effective. But acne for vitamin C for skin tone, skin texture is have a very crucial role.
Right, right.
Generally, we generally try to avoid all type of serum preparation. After a little bit settlement of the active acne, we generally prescribe the night preparation for maintenance
Hmm.
therapy.
Right, right. So, doctor, again, speaking about the sun or sun exposure, how important is sunscreen in today's world? I mean, when we were young, we have never heard people asking us to apply sunscreen before going out. I have never done it in my entire life. So nowadays, there is this a lot of talks about sunscreen. We hear the dermatologist asking us to apply sunscreen. We hear our parents to apply sunscreen when we are going out. In fact, in the entire body, hopefully. So, what is the importance of sunscreen in acne management? And the right proportion to apply, the right time, how many times to apply? If you could please elaborate.
You asked a very nice question. Actually, sunscreen has definitely a beneficial role for everyone because sunscreen is one thing that makes the half of the job of a dermatologist done because we generally can maintain this texture. We cannot delay the aging, but we can slow down it by application of sunscreen. Sunscreen is one preparation that also improve the skin tone and decrease the pigmentation, the post acne pigmentation. All these things are going to improve with application of sunscreen. But one thing is very important to mention that you have to choose a right sunscreen. Which sunscreen has to be chosen for the patient. That's definitely not by seeing any. Uh, we can evaluate it through the skin tone, skin texture, what type of skin the patient has, so definitely choosing the right sunscreen is very important for a acne prone skin.
Right. And if we talk about the skincare regime, what would be the best possible skincare regime? There are also a lot of people who does not know how to use the sunscreen and when to use the sunscreen and where is the exact placement of the sunscreen in the skincare regime. So if you could also explain about that.
We can apply the sunscreen in the morning. After that, if you are going outside, even if you are using laptops or any gadgets also, you have to apply the sunscreen every 2 hours. If possible, otherwise at least twice. In the morning after within 3 to 4 hours. You have to apply sunscreen all over your face and if going outside, you can apply over the exposed part also, like
Right.
hand.
And and like when does sunscreen come after? We use it before the moisturizer, after the moisturizer.
I ask the person to use it up. Thereafter, he or she can apply anything over the face, whatever she or he is doing.
Right. Now let's talk about makeup products. There are a lot of people, women, who need to use makeup maybe because of their work. Now, uh, if the patient is having acne lesion on the face, do we suggest them normal usual makeup? Can they go with it? Can they do it?
Generally, we ask them to avoid when they have active acne, but any function or something like that they can't avoid. Ask them to apply it gently over the face, and thereafter, after returning from the party or somewhere else, wash the face properly and use moisturizer at the night or any skin cream or anti-acne cream the doctor advised apply at the night after applying a gentle moisturizer over it.
Right. Well, again, coming back to sunscreen, the biggest task about choosing a sunscreen is we don't know which sunscreen will go with our skin type. We normally tend to choose the wrong sunscreen. We have no idea about what is SPF. We have no idea about when to use the sunscreen. Also, we see a lot of people who says कि हम तो घर पे ही रहते हैं, हम तो घर से बाहर जाते ही नहीं है, तो सनस्क्रीन लगाने का ज़रूरत नहीं है। So, what do you have to say to those people? Also, how do we choose our sunscreen?
We used to tell the person, I used to tell the person, yes, you are staying inside. You are not able to see the sun, but sun is able to see you. So that definitely
Mhm.
you have to wear your sunscreen wherever you are staying in or out once daily. If you are going out, then you have to reapply it after 3 4 hours. So mostly we decide the sunscreen based on the skin type. Like if you someone have a acne prone skin or oily skin, you generally advise them gel based sunscreen. Or if
Mm.
working women who are going outside, I we prefer to use them, advise them the matte finish. Few people like the matte finish sunscreen, and in children's we generally prefer to you advise them the physical sunscreens. So there are different types, like you told, SPF is the sun protection factor. So more than 30 SPF is sufficient enough for the Indian skin. It is not like that you are using SPF 50 means you have under a more protective umbrella, and someone is using SPF 30 means it is a less protective umbrella. More than 30 SPF is sufficient enough for the Indian skin. But the
Mm.
SPF 50 or 50 depend, we decide on not on the basis of SPF. We decide on the product or the component it has.
Right, right. Now coming back to another main factor which we never put in head to. So, what about stress, doctor? We see a lot of disease which is caused by stress, and we tend to neglect it mostly because we cannot see that the cause the the condition which is caused by stress or tension, we can't see it through our naked eyes. So does stress also has a role to play in acne
Stress is
formation?
a connecting link for acne, because if a person cannot sleep for one night, next day, yes, he will get acne, because that much relation it has with acne, because all the hormonal parameters, the hormones and the melatonin, all these things released in the body get altered by the sleeping habit. So mostly it get affected with stress, sleep, food, diet. All these things are definitely have a role. Even the hormones. Many of the girls that came to us and told that they are getting acne during the periods time or mid of the period time. All these things are because of the hormonal issue. So acne is a
Hmm.
not single disease. It is a multidisciplinary approach. It is a multidisciplinary disease. It has a relation with the diet. It has a relation with habit. It has a relation with uh, the fooding habit, your sleep cycle, stress level. All these things are related to acne, the sequelae of acne, severity of the acne.
Right, right. Doctor, let's talk about another important factor, hydration. We tend to forget drinking water nowadays. We have forgotten how to drink water. We avoid drinking water throughout the day, especially maybe because of our work culture and how time has changed. We tend to forget how to drink water. So, is hydration also important in managing acne?
Yes, yeah. Hydration will improve your skin tone, your skin texture, your oxidative stress level. All these things is going to improve with the hydration level. So always we ask the standing instruction to a acne person: drink proper water, have a good sleep, less carbohydrate rich food, increase your green leafy vegetables, your protein, increase your protein diet. All these parameters are advised. These advised parameters are always in the prescription we have.
Right. Again, speaking about protein diet, we see our society nowadays it has been divided into two categories. One category who are very much accustomed with having junk food, having a bad lifestyle, drinking a lot of alcohol, maybe smoking or is also included in that. So we have this one category. There is another category who are fitness conscious. They are conscious about their health. In that manner they tend to take a lot of protein because they think कि, to cut down the weight protein is very much important for your body. And उसी चक्कर में हम बहुत सारा प्रोटीन पाउडर प्रोटीन शेक्स ले रहे हैं आजकल प्लांट बेस्ड प्रोटीन्स अवेलेबल है तो they are also taking natural protein, they are also taking synthetic protein. So can this overconsumption of protein also be harmful, and is there any direct connection with acne management?
Whether consumption of anything is bad, obviously. We generally ask them for natural source of proteins. Egg is the best source of protein. Though we can take the example for many celebrity or many of the people, health conscious people, the sportsmen, they are mostly prefer the natural proteins. They take the natural
Mm,
proteins. Along with they might taking small amount of the these all proteins, fats, all these things, but generally they prefer for natural source of protein. One egg has a 6 gram of protein. So if a person average weight is 60 gram, 60 kg, that person needs 60 gram of protein per day. So that we can take the sprout, we can take green leafy vegetables, legumes. All these are natural source of protein. So we can add in our diet.
right, right. Well, that's what we always suggest our viewers, our patients, that please go for natural things. Everything natural will make you rid of most of the problem of your life. Basically, everything synthetic and man-made is causing all the trouble which we are getting to see nowadays. We see a lot of kids suffering from acne nowadays. We have seen kids suffering from diabetes nowadays, maybe kidney stones nowadays. We have never seen that in our entire life. So but the change which is caused due to time and our lifestyle, specifically our lifestyle, uh, it can only be controlled if you have a healthy lifestyle. If you sleep uh, at the right time, get your proper sleep, eat well, stay hydrated, and give yourself at least 1 hour. That's all the doctors would say that physical exercise is very much important, and eating well, thinking well, staying positive, away from stress is very much important. So as we are talking about acne management today, we are in discussion with Dr. Ipsita Debata, and we are having a wonderful chat about the basic things, the basic lifestyle which can make your skin look better and which can make your skin acne free. Doctor, are there any triggers also for acne apart from these factors which we have already discussed? Are there any other triggers which can make acne worse?
And can you repeat the question?
Yes, absolutely. What I was asking is, apart from the factors which we have already discussed, are there any other factors which can trigger acne apart from
There are
these, the food and
about of drug. There are many drugs which generally increase the acne production. There are many antipsychotic drug, antidepressant drug, tuberculosis drug, few of the steroid preparation. What you told, no, this protein. Many people are taking some drinks for muscle building. All this they contain steroid. All these are leading to acne production. That thing we have in our discussion. Drug is also a reason for aggravation of acne.
right? Doctor, we also see a lot of women who trust oral contraceptive pills religiously. We see them taking those like chocolates, maybe. So, can that be harmful? Can that also lead to acne formation?
No, actually, oral contraceptive pills are decreasing the acne severity. It is a mode of treatment in hormonal acne.
Well, ladies and gentlemen, that was a wonderful discussion with Dr. Ipshita on acne management. And we thank you so much, Doctor, for joining us today for your valuable time. It has been a very informative session for all our viewers today. And it was great to hear from you. We'll look forward to many more such sessions in coming time. Also, thank you, viewers, for your excellent participation. For more information on skin health and care, stay connected to our page, Beautiful Spotless Skin. We are also available on YouTube, Twitter, and Facebook. Thank you so much. Have a nice evening. Stay safe and stay healthy.